Hi, my name is Stacy, and I'm going to be doing an abdominal, musculoskeletal, as well as a neurological assessment on my dear husband. So first, I will start with hand hygiene, and I'll ask my patient to lift his shirt so I can get visualization of his abdomen. So I'm just going to do a general inspection, just to look for any discoloration, any abnormal pulsations, any thrills, any lifts or heaves, and everything looks symmetrical. I see no coincide around that umbilicus. Okay, so just going to take a listen if you don't mind. Listen to bowel sounds in all four quadrants. And I do hear some gurgling, and its bowel sounds are neuroactive. So I'm going to listen for some bruits. So first I'll listen for aortic bruit, just above the umbilicus, and renal arteries now, right side, left side. Now iliac arteries, and femoral, and I hear no bruits. So next we'll do some percussion. So I will percuss where his liver, and since the liver is dense, it's going to be tympanic. And on the left side, we'll percuss for the spleen. And this is just an estimate of the liver and spleen span. And so now we'll do a scratch test. So we'll just scratch around where the liver is, and we'll listen with our stethoscope as we scratch. Okay. And so now we'll do some palpation. So we'll start with light palpation. And as we're palpating, we're looking for any signs of distress or discomfort in our patient, which he appears to be going to sleep, so I will say there is none. Okay, Mr. Go, now wake up, and I'm going to have you take a deep breath. And now I'm going to press under his rib here. And this is the Murphy sign. We're just looking for any increased pain or discomfort or tenderness, and that is, if he does have more pain, that is a positive sign for cholecystitis. And so now we're going to do the psoas sign, and this is going to test for appendicitis. So we'll just place our left hand on his thigh, and then raise his leg. So there is going to be some resistance with our hand. And if he has any pain, that is a positive sign for appendicitis. So now we're going to do the obturator muscle test. So we're going to flex this right knee. And then we're going to press on the lateral side of the thigh. And then we're going to take our other hand and move the calf kind of outward. So it's like opposing forces here. And of course, if that is increased pain, that's a positive sign for appendicitis as well. And now we're going to assess at Bernie's point. So it's lateral to the umbilicus on the right side. And so we're just going to press and withdraw quickly. If he has any rebound tenderness, then that is also a positive sign for appendicitis. Okay, so now we're going to move over into the musculoskeletal assessment. So our patient is still supine, so we're going to do some hip flexion. So we're going to flex and extend, and then now we're going to do abduction, ABD, moving away from the body, and then adduction, AD, moving towards the body. And we'll also take note if there's any pain with any of those exercises. And then we'll also do some internal and external rotation. Okay, so now we're going to do a straight leg raise. Gonna come straight up. And there should be no increased pain there. And we're going to do ballottement. So we'll just expose a little bit more of his leg here, and we can pull that down. And we're just going to press down on the thigh towards the knee. And then we're going to tap that knee to see if there's any effusion. And the bulge test, it's kind of similar in that we're also going to move some fluid down and then press on the medial side and see if there's any effusion on that knee, which there is none. Very good. Okay, so now we're going to do the McMurray test, which is going to test for any abnormalities with the meniscus. So we're going to rotate the foot as we're flexing the knee. So we're going to flex the knee and support it with that one hand, and then we're going to extend it while we're rotating that foot. So like this. And now we'll do it inward. Okay, very good. And now we'll do our drawer test. So we'll flex that knee. And we can sit on the foot here for some extra support. And then we'll do a quick thrust towards me, like that. Okay. And now we'll do our Beer's test. So we're going to abduct the hip. And then foot out, that, and valgus, almost the same, but we'll rotate the foot in, like that. Okay, and now the Lachman's, this test for the ACL, so we'll just, we can put our leg under his thigh for some support since he is a larger guy, and we'll just kind of that leg there. Okay. So now we're going to have you sit up, Mr. Gill, and I'll have you face me. Well, you know what? You face there, face the camera. Okay, very good. So now we're just going to do the tunnel test for carpal tunnel. So we'll just tap along that medial nerve there. There should be no increase in pain as we're tapping. Okay, so now we're going to do the Phelan test. So I'm just going to have you mimic what I do. So go like this. Okay. And there's an increase in pain. That is a positive sign there. So now we'll do the Sperling's test. So we'll just have you kind of tilt your head to the left. I'm going to apply some pressure. And this test for a cervical radiculopathy. The same on the other side. Okay, very good. So now I'm going to have you do the drop arm test. So again, just do what I do. So we're going to bring our hands up. And then we're going to gradually put them down. Should be controlled. Positive tests would be if he's not able to maintain that controlled movement as he puts his hands or his arms up and then gradually puts them down. Okay, now we're going to do the Hawkins test. So I'll just have him drape his arm against mine. Then this is totally passive. So I'll move his arm inward like that. Okay. So now we're going to do the Finkelsteins. So with this one, we would just have the patient put his arm like on a table, and we would put some downward pressure on that hand there. And that test for Dequebrians. So now we're going to do an empty can test. So we're going to have you extend your arms and then just turn your thumbs down. Okay, and he's able to do that with no issues and no pain. Very good. Okay, so part of the musculoskeletal assessment would just be to do an inspection of any joints. We're assessed for any crepitus, any pain, nodules, which you don't see any. And we also do some capillary refill. So we'll just press on his nail bed, and it should return, the color should return within 2 to 3 seconds. And we'll also do that with the toes as well. And if a patient were to have polish or like nail polish on their nail bed, you can also do it just by pressing on the toe there. Same thing with the fingers. Okay. So now we'll also palpate the radial pulse. Okay, and then we'd also palpate the dorsalis pedis pulse here. And brachioradialis. And we do that on both sides. And it is okay to do them simultaneously, bilaterally. And now we're going to also palpate the posterior tibial. So there. Okay. Alrighty, so now I'm just going to do some more range of motion. So we're going to flex the neck, like that, look down, and extend, hyperextend. Okay, then we're also going to incorporate our strength test as well. So try to look down, look up. Okay, very good. And that was just with resistance. I put some resistance as he tried to move against that, which he was able to do. And so we're going to do some lateral neck bend, other side to side, rotation. Okay, and now we're going to do the the elbows. So do some, well, just do what I do. So extension or flexion, extension, then try to flex. Okay, and try to, okay, very good. And now we'll do the wrist. So flexion, extension, and we'll do that against some resistance. Okay. Okay, very good. And now we'll do some abduction. So like this, or then like that. Okay, very good. And I'll have you squeeze both of my hands here. Okay, good. Nice and equal and strong. And I'm going to take our fingers. I'm going to do some flexion, extension, and then we'll do some abduction, adduction, each of those. Okay. So now we're going to also look at the anatomical snuff box. So it's going to be on the radial side of our patient's hand here. So just right in there. Okay, very good. And we'll also do some ankle flexion. So we'll have patient some dorsiflexion, or that's plantar flexion, dorsiflexion there. Okay, and then we'll do inversion, rotating in, then eversion, rotating out. Okay, very good. And then we'll also do that strength test with the ankle. So we'll have him do a dorsiflexion and plantar flexion with resistance. So can you please try to point your toes to your nose? Okay, then press the gas. Very good. Okay, and so now I'm just going to have you stand. And then again, we're just going to mimic what I do. So we're going to do some shoulder flexion. Okay, then extension, back. Very good. And now we're going to do abduction. So we'll just bring it out like this. And then adduction, ABD. Go across. Okay, very good. And now I'm just going to have you try to lift your arms against resistance. Okay, and then try to bring them down. Okay, now let's go with resistance. Okay, so now we're going to do some knee flexion. Okay. So just mimic what I do. We'll flex. Yes, extend. Okay. Inward rotation. Out. External rotation. Okay. Alrighty. So we'll sit back down. Oh wait, just kidding. Stand back up. Sorry. I forgot this one thing. Okay. So we're going to have you bend over like this. And we're just going to be looking at the curvature of his spine here, or hopefully lack thereof. We can also just shirt for better visualization of that. Okay, and then now we're going to have you bend to the side. Great, and the other side. And rotate. Okay, very good. Okay, now you can sit for a little bit of time. So now we're just going to do our neurological assessment. So we can start by assessing our patient's orientation to person, place, time. So what is your name?
Daryl.
What year is it?
2021.
Where are you right now?
At home.
Who is the current president?
Joe Biden.
Okay, very good. And he passes. Good. Okay, so we can also assess for memory. So I will just have him repeat back to me a series of 4 words. So 4 bananas, ceiling, and oranges. Okay, so repeat that back to me.
4 bananas, ceiling, oranges.
Very good. He passes. Okay, so now we're going to assess his judgment. So I would just ask him a question that would be fairly sensible. Okay, so if you're inside a burning building, what would you do?
If I was inside of a burning building?
Yes.
Get out.
Okay, very good. Hopefully you wouldn't try to rescue me, but yes, get out. It sounds very good. Okay, so then now we're going to assess DTRs or deep tendon reflexes. So we'll just grab our percussion hammer. And our first one will be biceps. So just tap right in here. Okay. Brachioradialis. So just have him relax. Okay. Let's see. No. Brachioradialis here. Patellar. Achilles. I probably can't see that. Okay, very good. Alrighty. Also, we'll do Babinski and Clonus. So I'll just bring back down here. So Babinski, for adults, we should see flexion of the toes. So we'll just take this kind of hard piece of the percussion hammer here and just go along the foot. If there were some Parkinson's, then he would have some fanning of the toes as we slip the percussion hammer down the length of his foot. And so now for Clonus, our final DTR, we'll just do some quick dorsi and plantar flexion. This, then release. And if it were to like be tremor or like quick movement, then that would be a positive sign. Okay, so now we're going to do our sensations here. Okay, so we're going to take 2 different materials. I'm going to close your eyes and take this hair clip and the end of this percussion hammer. So we're just going to palpate in different areas, like on his arms and his legs, and he'll tell us where we're palpating. Sit up. What are you doing? Close your eyes. And then you're also going to tell me if this is sharp or smooth. Okay?
Okay. Sharp.
And where is it?
Forearm.
Okay.
Smooth. Calf.
Okay.
Sharp shin.
Sharp chin.
Smooth forearm.
Okay, very good. And so now we're going to do sterignosis. So this is where we'll just have our patient close his eyes and we'll place something familiar in his hand and he tell us what it is. Okay, so close your eyes, dear. I'm just gonna place this in his hand and he'll tell us what it is or come close.
Marker.
Okay, very good, close enough. It kind of feels like a marker. It's actually hand sanitizer, but it feels like a marker. Okay, good. And so now we're going to trace something. I'm going to trace something in the palm of your hand. And you're going to tell me what it is. Close your eyes.
A.
Okay, very good. Yes, it is A. Alrighty, so now we're going to do serial finger opposition to nose. So I'm just going to have him look straight ahead and hold my finger up to his, or in his plane of view here. And so I'm just going to have him touch his nose and then my finger and do it quickly. Okay, very good. He passes. Yay! Okay, so now we're going to do pronator drift. So I'm just going to have you extend your arms with your eyes closed. And we should see very little deviation. He's able to maintain that position pretty level. Okay, very good. And so now we're going to do heel to shin. So I'm just going to have you trace your heel down the length of your shin. Okay, and then we'll do the other side. Okay, perfect. And now we'll do some foot tapping. So I'm just going to have you pat my hand here. Okay, very good. Alrighty, wrapping up here. Let's see. So now I'm going to have you stand up, Mr. Gill. Okay, so I'm just going to have you close your eyes. Stand up straight, babe. Close your eyes, and I would stand close to this patient for some support should he need it. And this is just a test we can use for Parkinson's patients because they won't be able to maintain their balance with their eyes closed. Okay, and his eyes are closed. The camera. Okay, and he's able to maintain that with his eyes closed. Okay, very good. And so now I'm going to have you just walk normally.
With my eyes open or closed?
Open. Okay, so we're just assessing his gait and rhythm. Walk that way, babe. Okay. And so it's symmetrical. Hands are moving somewhat rhythmic in line with his feet. Okay, so now we're going to do you're going to walk on your tippy toes to the door. Okay, you're going to walk back on your heels. Good. And now you're going to walk along like a sobriety test. But you wouldn't know because you don't drink and drive. Good. Oh, yikes. Oh my gosh. Thank gosh you're at home. You failed. Okay, very good. And so that concludes our assessment of the abdomen, musculoskeletal, and neurological assessment. Thank you.